There's a specific tissue in the eye called the uvea. Any inflammation of this uveal tissue is called uveitis. To simply put, it is the brown tissue of the eye that we see, or the iris. The same tissue extends behind the eye. Any inflammation of this uveal tissue is called uveitis. Redness of the eyes, which may be persistent, associated pain, photophobia or increased sensitivity to the light, and appearance of floaters in front of the eyes or cobwebs in front of the eyes. All of them together or in combination with each other could be early symptoms of uveitis. Advanced symptoms of uveitis may present with significant blurring of vision in one or both the eyes. Uveitis is a known association of many systemic rheumatological diseases or inflammatory joint diseases such as rheumatoid arthritis, ankylosing spondylitis, or other diseases such as systemic lupus erythematosus or SLE, Behçet's disease, or multiple sclerosis, just to name a few. It can also be rarely associated with gastrointestinal inflammations such as inflammatory bowel diseases. To answer the first part of the question, it's extremely unusual for uveitis to be hereditary, but certain genetic mutations can predispose certain individuals to a specific type of uveitis. And to answer the second part of the question, that is uveitis related to infections? Yes, there are some infections such as tuberculosis, herpes simplex viruses, or syphilis that can also lead to uveitis. Those are the infectious forms of uveitis. If a patient is already on immunosuppressive drugs or drugs for controlling the inflammations of their joints, if they suddenly change the dosage of their drugs, or if these drugs are stopped or modified, then uveitis may also flare up in such conditions. One, do not stop the treatment on your own if you are already on treatment. Do not change any medicines on your own. Make sure you consult your physician before you changing the medicines. And second, of course, a healthy lifestyle and a stress-free lifestyle does reduce recurrences of uveitis. The diagnosis of uveitis is essentially clinical. For example, a clinician would see inflammation of the eye and put it into a specific pattern. So it's recognizing these specific patterns or pattern recognition is what prompts us specialists to order targeted investigations. And depending on these targeted investigations, a diagnosis of uveitis is made. At times, even despite doing multiple investigations or thoroughly investigating, we might not reach a conclusive diagnosis of uveitis. Immaterial of that, the treatment of uveitis is very, very important. The treatment of uveitis involves a holistic approach from the ophthalmologist along with the rheumatologist, the physician, the pulmonologist, or the dermatologist, as and when these specialty interventions are required. So the eye is made up of a lot of delicate structures. Any inflammation damages these delicate structures, and these structures are critical for the visual function in their own sense. Long-standing inflammation will cause permanent damage to these delicate structures, and the vision can be lost. Hence, an early diagnosis or a timely diagnosis and timely treatment is very important to save vision and to prevent permanent visual loss.